Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Thyrotoxic crisis or thyroid storm. So, what is thyrotoxic crisis or thyroid storm? In thyrotoxic crisis or thyroid storm, it is actually an emergency condition. In this, the patient will develop severe hyperthyroidism, which is called as decompensated hyperthyroidism, because of increased thyroid hormones. So, because it is an emergency, we should treat it immediately. So, in the treatment of the thyroid storm, in the treatment of thyroid storm or thyrotoxic crisis, here this occurs due to sympathetic overactivity. So first and foremost, the important thing to give is non-selective beta blockers should be given to the patient. Especially propranolol is indicated in the patient. This is the most valuable measure in thyroid storm. It is actually most important in thyroid storm. Okay, then in thyroid storm, these beta blockers are given because there is increased the rationale behind giving these beta blockers in hyperthyroidism or thyroid storm is because of the increased sensitivity to the catecholamines in the hyperthyroidism. So it is given to increase the tissue sensitivity to catecholamines in patients with hyperthyroidism. Why is there a increased tissue sensitivity to catecholamines? This is because actually there is in thyroid storm, okay, in hyperthyroidism or thyroid storm, there is increased number of beta receptors. Because of increased number of beta receptors, this increased number of beta receptors is responsible for increased tissue sensitivity to the catecholamines in hyperthyroidism. So as a result, in order to decrease the sensitivity to catecholamines, we give non-selective beta blockers. So once you give non-selective beta blockers, the patient will have quick relief. Quick relief is seen or is obtained by giving the non-selective beta blockers, that is propranolol. Then the next drug which can be given is propylthiouracil, which is an anti-thyroid drug can be given. This propylthiouracil is actually the anti-thyroid drug of choice for thyroid storm. Why is it the anti-thyroid drug of choice for thyroid storm? Because propylthiouracil, obviously it inhibits or reduces the thyroid synthesis. Along with that, it will also cause peripheral, or it will also inhibit the peripheral conversion of T3 and T4, and as a result, because of its dual effect, whereas methimazole and carfimazole, they do not inhibit the peripheral conversion of T3 and T4. So because of this dual effect, we use propylthiouracil as the drug of choice for thyroid storm. Then we can also use one more drug like corticosteroids or hydrocortisone can also be used in thyroid storm. This hydrocortisone also has the similar functions. It will also reduce the release. It will reduce the release of the thyroid hormone. Actually, this uh, corticosteroids will reduce the hormone release, and it will inhibit the peripheral conversion of T4 and T3. So it can be used in thyroid storm. Then in thyroid storm, we can also give iodides are also approved. In the iodides, we have different types of iodides. We have potassium iodides and hypernoic acid. So this potassium iodides and hypernoic acid can be used in the thyroid storm. These will inhibit the hormone release from the gland. So we can use these also. Then we have other measures. In the other measures, we can give diltiazem and can be given. Especially diltiazem is given if the tachycardia is not controlled by propranolol. You have given propranolol, but still if the tachycardia is not controlled by propranolol, in such cases we can give diltiazem in the patient. We should advise the patient to have proper hydration, to undergo proper rehydration, to drink adequate water. We should ask the patient, which we can give anxiolytic to the patient. If the patient has any anxiety symptoms, we can do external cooling, and appropriate antibiotics can be given to the patient.
Thank you and thank you for watching.